Hi, thank you for inviting us to talk about preventing aspiration pneumonia by promoting oral health and about the Manor Nursing Home Project in Morrisville. So before we get started, we thought we'd share a picture of ourselves with you so you can kind of put a face to a name. Linda Greaves is on the left as you look at the screen, and I'm Robin Miller. I'm on the right, and we both work at the Office of Oral Health here at the Health Department. Linda, do you want to add anything?
Um, I also work at the Office of Local Health in Morrisville, so I am the public health dental hygienist in that area.
Great, thanks. We also wanted to share with you a little bit about why we're interested in this topic. And I remember first learning about this when I was speaking with Carol Wood-Koob, who's the former healthcare acquired infection coordinator here at the health department. And she was telling me about a conference that she had been to when this research about the connection between aspiration and pneumonia and oral health was presented. And so I started reading about it, and it's just another reason why oral health is so important for residents of nursing homes. Linda, I know you have a connection too.
My connection was with Val Velcor, who was the district director of the Office of Local Health in Morrisville. She invited me to a meeting about oral health with partners, the Manor and the dental clinic in Morrisville. She said to me, she goes, I think you'd be really interested in coming to this meeting with me. And that's where it all began. Project.
So just before we get started, here are some things that we're going to talk about today. We're going to talk about some of the special considerations of oral health for older adults. Then we'll share some key findings from our 2013-2014 oral health survey in nursing homes. Then we'll talk about how oral health care can affect pneumonia. And lastly, Linda will tell you more about the project that we're involved in with the Manor Nursing Home in Morrisville. So oral health is an important part of overall health at all ages, but there are some special considerations for older adults. As we're focusing on today, poor oral health or dental complications can put older adults at greater risk for aspiration pneumonia. Also, many adults are on multiple medications, many of which can cause dry mouth, which is a risk factor for dental decay. Saliva is a protective factor which helps wash away food and debris and neutralize acid. A decrease in saliva due to medication can put someone at much greater risk for dental decay. Research shows that poor oral health may increase a person's risk for heart attack or stroke, and that there's a two-way relationship between periodontal disease and diabetes, with uncontrolled diabetes increasing a person's risk for periodontal disease, and periodontal disease making it more difficult to control A1C levels. Lastly, poor oral health can make it difficult to eat healthy food, which can lead to weight loss and failure to thrive. It can also make it difficult to speak and sleep, affecting overall quality of life. So in 2013-2014, the Office of Oral Health did a survey of 342 Vermonters living in 8 nursing homes, and there were 5 key findings, which I'll share with you now. The first has to do with the number of natural teeth. The majority of residents had at least one tooth or more, with a mean total number of teeth of 16 and a half. The loss of teeth impacts the ability to chew, and as we talked about, can limit food choices. Tooth loss also inhibits speech, impairs social interaction, creates low self-esteem, and detracts from a person's general appearance. 39% of participants in the survey did not have any natural teeth. So now we'll talk about dentures and the use of dentures. So nursing home residents with no occlusal contacts, meaning their teeth didn't come together, or poor fitting dentures avoid eating hard foods that require a lot of chewing because it becomes painful for their mouth. Dentures that don't sit properly on the gum and bone structures can also easily slide around the mouth, causing discomfort and pain. Almost half the residents had any partial or full dentures. Among those with no natural teeth, 1 in 4 did not have any dentures. Among those with dentures, 14% of participants with an upper denture and 26% of residents with lower dentures did not wear them while eating. 43% of residents had no functional occlusal contacts, as I said, meaning that they had no contact between their upper and lower teeth when they bite, due to either loss of teeth or improperly fitting dentures. Now we'll talk about the need for dental care in the nursing homes. Among nursing home residents with teeth, several oral health problems existed, including untreated decay, severe gingival inflammation, substantial oral debris or plaque, and periodontal disease. So periodontal disease meaning the bone that supports and surrounds the tooth. Among the residents surveyed, a combined 42% required dental care, with 8% needing urgent care and 34% needing care within the next several weeks. Soft tissue lesions were found among 6% of the residents. So lastly, as we discussed earlier, dry mouth and reduced saliva flow are common disorders caused by chronic diseases and medications. 56% of residents surveyed had dry mouth, which puts them at higher risk for dental decay and periodontal disease. So now we'll talk about the connection between oral health and pneumonia. I'm sure this first bullet comes as no surprise to you. Pneumonia is the second most common healthcare-associated infection worldwide. Preventing pneumonia is a cost-reducing and life-saving healthcare practice, both in acute and long-term healthcare settings. Patients in nursing homes can acquire pneumonia by aspirating oral bacteria that's been colonized in the mouth into the lower airway. Patients often have difficulty performing their own oral hygiene due to illness, old age, dementia, or functional disabilities. Consequently, as we've seen with our survey here that we've done in Vermont nursing homes, oral hygiene can be poor. So the information on this slide comes from a 2015 systemic review and meta-analysis of randomized controlled trials. The primary goal of the review was to assess the effectiveness of oral health care on the incidence of pneumonia in non-ventilated patients. Unlike ventilated-associated pneumonia, the effect of oral care for preventing pneumonia in non-ventilated patients had not been well established. So 5 studies consisting of over 1,000 subjects met the inclusion criteria. Of these, 2 trials assessed the effects of chlorhexidine, which is an antibacterial mouth rinse, in hospitalized patients, and 3 examined mechanical oral cleaning or toothbrushing and professional dental care in nursing home residents. This review and meta-analysis showed that the combined effect of mechanical oral care in combination with professional care significantly reduced the risk for nursing home acquired pneumonia for elderly nursing home residents. So now I'll turn the presentation over to Linda to tell you about the project at the Manor in Morrisville.
This project began in 2014. Lynn Smith, the executive director of the Manor Nursing Home in Morrisville, had reached out to her community partners to help take the challenge of providing a comprehensive oral health program to her residents. So the key partners in this project are the Community Health Center of Lamoille Valley, which is a federally qualified healthcare center that has a dental clinic, and the Office of Local Health, which has the public health dental hygienist. So this article above from the Provider Magazine in issue March 2013 described how Kansas initiated their oral health program into long-term care facilities. And their success was with this oral health training program called BLISS that had been used over the past 14 years in Kansas. This program has been copyrighted and has a patent pending for the software version. In Morrisville, we use the North Carolina DVD, Mouth Care Without a Battle. So at each facility, and this is again describing Kansas, a dental hygienist trains a team of staff known as the oral health team. The team is responsible for providing oral health assessments, which were just like basic screening surveys that Robin just described, and referrals as needed. The program included initial and quarterly oral health risk assessments, which is a high need because of the turnover in nursing homes, referrals to dentists as needed, identification of dentures, staff oral health in-service presentations, and most importantly of all, was the maintenance of the daily oral care for residents who find it difficult or impossible to provide it for themselves. So this is what Lynn wanted to duplicate at the Manor. This is what she presented to us as community partners. So what we know to be true, everyone was well educated on the fact that good oral health, it makes it easier to eat, to be well, to be active, and live a healthy life. When your oral health is poor, as Robin described before, eating healthy food becomes really difficult. This increases the risk for health problems such as chronic disease, heart disease, stroke, aspirated pneumonia, which we talked about, and diabetes, which escalates completing simple activities of daily life and makes it even more difficult for the residents to help themselves. So So as you can see, this is the slide that just, without all these things, it gives us an increased risk of the disease. So the older adult basic screening survey, which Robin described earlier, we decided to use it because we needed a snapshot of oral health among the Manor residents to develop a plan. Our goal was to find out what the oral health needs were among the residents of the Manor, and this enabled us to create a plan for the residents to receive dental care either in-house or at the dental clinic. So this is what our on-site basic screening survey looked like. The hygienist screened each patient either in the living room area or actually in their room. So this information we collected to assess their needs. And again, this helped us create an individual oral health plan for each resident. So this is our oral health team project plan. It took us 11 months to organize an oral health care plan that we thought would be a good beginning. Our first rollout was May 7th, 2014, to begin to see residents. We also established outcome measures for them. The first one was the number of residents that received care. The second, a reduction in gum disease. Third, reduce weight loss by getting their pain under control so they could eat healthy. And the fourth one was to reduce the rates of aspirated pneumonia. So our oral health team met for all the staff were required to attend meetings based on the North Carolina DVD, Mouth Care Without a Battle. So we were able to work with our CNA local program and instructors to update their oral health section in the curriculum. So the results of this oral health team project plan was the dental hygienist and the staff members worked together to help make the daily oral hygiene plan for each resident. They placed the plan in each of the residents' electronic care plan and also displayed them in the resident's room. So one of the goals for better health was to reduce the occurrence of aspirated pneumonia. By educating the staff about the germs from the plaque, which Robin described again earlier, which can get into the lungs and cause pneumonia, was helpful. We reviewed studies that showed brushing teeth reduces pneumonia in nursing homes in the residents by reducing the amount of bacteria in the mouth. So our care coordination, in this slide, there are two pictures. The picture on the left, I'm just going to describe the people involved. Steve Arthur, who was our past dental director. Kevin Kelly, who was the past CEO for the Community Health Center for Medical and Dental Clinics. Sandy Bayan, way in the back, who was the dental hygienist. Chris Lachuk, who's in front of her, was the director of nursing. Lynn Smith was the executive director, and myself, the public health dental hygienist. And why I wanted to show you this is I wanted to show you the dental equipment that was purchased by the Manor. The chair is a Brody chair, which is awesome. It is used not only for dental, but also for other residents in the nursing home. And the portable equipment has handpieces not only for the hygienist, but we also have them for a dentist too. To the right of this slide is one of the LNAs at the Manor. And her participation, she would bring the residents that were scheduled for dental care to the hygienist. She would also update the hygienist on the patient's behavioral health and the well-being for that day. This was a key to our success. It was so helpful. So this is our dental room at the Manor. The dental hygienist is the liaison between the Manor residents, the families, medical providers, and the federally qualified dental care clinic in Morrisville. The hygienist at the time was an employee of the dental clinic, and the billing was processed through the federally qualified healthcare dental clinic for her services at the Manor. A high percentage of the residents had Medicaid insurance, and there were very few private pay. Families were notified about the dental services at the Manor and would request care for their loved ones. All the dental supplies were purchased by the Manor. So we did have challenges, as you can well expect. Patients with dementia, that created a limited time for the LNAs to complete everything before their shift ended. The LNAs were engaged with daily brushing care, but if the resident doesn't wish to have their teeth brushed, it got passed on to the next shift. The workforce shortage. There is a shortage of nurses and LNAs for nursing homes, which I'm sure you're well aware of. So when the workforce changed, dental care trainings needed to be part of the new employee orientation. And it was strongly recommended that dental education trainings be revisited on a biannual basis to keep the workforce engaged. As you know, at the nursing home, it gets really very, very, very busy. And space became an issue too, as a hygienist needed to share the same place with a training certificate program and nursing assistant at the Manor, which was a 6-week rotation program. And the biggest one, I think, with all of us in anything we do is about communication. So communication with patients, families, and staff will always be a work in progress. The most important factor is keeping everyone informed about the services and when the hygienist is scheduled to see the residents, so everyone knows when she's coming. So successes, it is pretty exciting. Now the dental hygienist can bill for Medicaid services. And what does that mean? That means a hygienist can now come in on her own with a general supervision agreement with another dentist if needed. The families are truly excited about the on-site care. We have had several family nights where families have attended, and they love the services provided because their loved ones can actually get it on site without having to leave the Manor. Transportation was never an issue for the Manor. The Manor has their own van, which is great. And the staff themselves, they were engaged in solving the challenges. Once we did the trainings, which lasted for a couple of months to get everyone trained, we would also have the staff come back to us with problem solving, questions. So they're very engaged. And the biggest, I think, factor too is the Manor has their own dental equipment, which becomes very pricey. So that was great. And last of all, they understand the benefits of the good oral health for the residents, and that's what started their program. So the Manor is celebrating their 4th year providing oral health care on site. They have a new hygienist as Sandy Van moved out of state. So this hygienist is able to bill Medicaid on her own. She has a supervising dentist from Winooski, so that is awesome. So the program continues, which is great. So here's our contact information. If you need to email us, there's Robin's email and myself. We're more than happy to answer any more questions for you.
Yeah,
thank you.
Absolutely. Thanks for letting us talk to you today about oral health.